Today we're going to deal on the most important topic, so that is a stroke. The stroke is a disease of cardiovascular as well as cerebrovascular disease. Here, it is also the resulting from it is a complication of underlying disease conditions like a diabetes mellitus and hypertension. Here, in the stroke, what happens and what is the reason for an individual developing a stroke, and what are the signs and symptoms we're going to see in case of a stroke, and how we're going to diagnose and how we're going to manage the stroke. Okay, so let us see one by one later. Here, the stroke. Now, coming to introduction about the stroke in a year. Okay, so in India, every year, the per lakh populations 102 to 172 people suffering from that is stroke. It is severity. The severe incidence is there. So that is 182. So that is 172 people per lakh population is suffering from stroke. Okay, so this much incidence because due to the lifestyle factors as well as underlying diseases. Okay, so not taking a proper treatment for a underlying disease condition is also one of the most important cause, a contributing factor for this the developing there is strokes. Now come the meaning. So what it means here, the stroke is nothing but the loss of a brain functions due to that is lack of blood circulation to the brain part of a brain. Okay, so is it means that is stroke. Here the stroke means the loss of brain functions due to the lack of blood flow to the part of a brain. Now commonly, there is a definition of a stroke. Here the stroke is defined as it is a medical emergency. It is a life-threatening conditions. So characterized by the that is loss of balance and the reduced visions. So the arm weakness, inability to speak or inability to walk, numbness and the seizures. So resulting from decreased blood circulation to the brain area, that is stopped blood circulation to the brain is called as a stroke. Okay, so in a simple way, the stroke is nothing but the stroke is defined as it is a condition in which the sudden interruption of the blood circulation to the brain it may lead to that is loss of balance, the arm weakness, numbness, and the seizures, and difficulty in walking as well as difficulty in there is speaking. Okay, so it is called as a stroke. Now coming types of a stroke. Here, there are two types of stroke. One is ischemic as well as hemorrhagic stroke. Here, ischemic. What it means? Ischemic means reduced blood supply to the brain parts or a part of brain. Okay, so it's called as an ischemic stroke. Ischemic is the lack of blood circulation to the brain. Now about hemorrhagic. Here hemorrhagic is nothing but so due to the hardening of the artery or as atherosclerosis, so rupture of blood vessels takes place in the brain, ultimately to interruption of the blood circulation to the brain. Okay, so it is called as a hemorrhagic stroke. Okay, so in the history, it's a strokes that is reduced blood supply to the brain. Okay, so due to the atheroma or atherosclerosis, but in the hemorrhagic stroke, due to the rupture of blood vessels, so the leakage of blood through the arteries, due to that the blood circulation to the brain is interrupted. Okay. Now coming to the causes and the risk factors for the stroke. Here the most important cause for the stroke is the diabetes mellitus as well as hypertension. Here just see how the relation between the diabetes mellitus as well as the stroke. Here the stroke is one of the most common complication of a that is diabetic mellitus. Here in case of diabetic mellitus, what happens due to the hyperglycemia or a increased blood glucose level, what happens it damages to the blood vessels. Okay, so damages to the blood vessels, it causes a plaque formations and atheroma formation. It interrupt, disturbs circulation to the brain. Okay, so it may causes a stroke. Okay, so also the hypertension. Okay, so in the hypertension, that is hemorrhagic stroke is very common. Now come to the other factors, there is atherosclerosis, there is thrombosis and the embolism. Okay, so these are the contributing causes for the individual will develop a stroke. Now come to the risk factor for a that is stroke. The lifestyle is very important factors. Because due to the dietary factors, as well as the individual not going to do as the minimum exercise also for the cardiac functioning as well as cerebrovascular functioning normally. So the sedentary lifestyles, there is no activity at all. Okay, it is also there are factors that may increases the risk of stroke, and also smoking, alcoholism. Okay, it is also contributing factors individual developing there is stroke. But the nowadays, the problem is a stress. The everybody is taking unnecessary stress. Okay, so stress also a very important factor for so the causing a so that is a stroke. Now coming, so what are the clinical manifestations? What are the signs and symptoms we are going to see in case of a stroke? First one is just for the remembering. So the name, remember that name brain, because they have a brain part is very important. The due to the less supply or interruption of the circulation of the brain causes a so the stroke. For a remembering, so that is the mnemonic, so that is as a brain. Here the balance loss of balance. Here the reduced vision, okay, so that is a vision problem, and so arm weakness, so inability to speak or inability to walk, and the N is nothing but numbness, and the S is nothing but seizures. Okay, so these are the clinical manifestations we're going to see in case of a stroke. Now coming to how we are going to diagnose, how we are going to identify a stroke. Here some of the diagnostic measures are there by using so those diagnostic techniques are going to diagnose a stroke. Okay, CT scan, MRI, angiography, and the ECG. Okay, so all these are the so the diagnostic measures. Okay, so we can diagnose the stroke. Now coming the management. Here, as earlier said that it is a medical emergency situation, it is a life-threatening conditions. Okay, the immediate treatment should be so the start. The first immediate treatment includes that is assessment of airway breathing circulation is very important because the suddenly patient under coma and his loss his life. Okay, so for that reason immediate care is important. The assessment of airway breathing circulations and providing oxygen is also the very crucial. Okay, so to restore so that is normal function. Okay, so that is a brain. Now coming is specific management. Here specific management includes that is a thrombus or any so that is any so that is bleeding, so that is thrombolytic treatment is very important for any bleeding hemorrhagic stroke. How to treat surgical options, that is thrombectomy for removing gas, that is thrombus, and the craniotomy. Okay, so depending upon the cause we are going to do a different surgery here. Okay, so this is regarding to the what the stroke, the information is regarding to the stroke. Okay, so the nowadays here the nowadays the increasing incidence of a stroke is alarming because it is a so that is the fourth leading cause of a death and fifth leading cause of a disability. Okay, so for these reasons the care of a so that is the persons who are suffering from medical diseases, those who contribute to the okay, so developing a stroke is very important. For example, diabetes matters as well as hypertension. Okay, so prevention of stroke, how we are going to prevent and what measures have to take prevent a stroke or minimize the complications of a so that is diabetes mellitus as well as stroke. Okay, so the first one is avoidance of stress. The modification of a lifestyle is very important. The avoidance of smoking as well as alcohol, and okay, so the avoidance of a sedentary lifestyles. Okay, so doing a physical activity. Okay, so these are the preventive measures that are going to prevent. Okay, so that is complications resulting from underlying disease as a stroke. Okay, so this is regarding to the what a stroke.